Good evening, my name is Jamie Cunningham and this is my video for the oral medication and ventrogluteal administration of Haldol this evening. So first off, I'm going to make sure that I am going to perform my hand sanitizer, clean my hands. Then I'm going to assess my medication administration record, which I have right here. Which the two medications I'm going to give is Delcosat 100 milligram tab orally, which our time to be given is now for stool softener, and Halperdol 2 milligram intramuscular, and our time for that is now as well, and it's for the control of agitation. Since we've reviewed our medication and on what we're going to give, then at this time, we're going to make sure that we have our appropriate supplies. So again, we're going to perform our hand hygiene. Then we're going to make sure we have our peel cup, which is right here. Our water, which is right here. The right size syringe, which is here. Our needle to draw the medication up, and the needle to administer the medication. We're going to have our clean gloves, our alcohol pad, and our Band-Aid. We also have the patient's bracelet, ID bracelet right here. We have our Haldol 5 milligram ml here, and we also have our Delcosat here. So now we're going to prepare our medication. So first off, let's go ahead and check our medication. We're going to check the date of our medication to make sure that it's not expired. 12 of 2022, it has not. It does say 100 milligrams. We've got 100 milligrams here, tab for oral, and it is Delcosat, so that does match. So we can go ahead and, by not touching our medication, we're going to, number one, put our first set of clean gloves on. And we're going to pop out our medication without touching it into our medication cup. Set this to the side. And then we're going to check our Halperdol vial to make sure that it is 2 milligram intramuscular. This is a 5 milligram intramuscular. So we'll need to calculate out. So we need 2 milligrams. So that would be 2. We will draw up. It is not out of date. It has not been tampered with. And 6 of 29 is its expiration date. So we'll go ahead and prepare to draw this medication up. And we have our 3 milliliter syringe here. Since we're going to draw up 2, we're going to add air back into the vial. At a 45-degree angle, we will go in, take it to a 90, add the air in, and we're going to draw up our medication here. And of course, we know that we need 2 milligram, and we know that this is a 5 milligram per ml. So we know we would need 7.5. And then we're going to withdraw, pull up our safety lock, remove this and put into our sharps container. And then we're going to prepare this to be administered. So we're going to go ahead and open up another needle, which is going into the muscle. So we need to have a 1.5 to a 2 inch. And then now we are ready, and we have verified our date of our medication. So at this point, we're going to take off our gloves, perform hand hygiene. Now we're going to enter the patient's room, and we're going to ask the patient her name. Hello, what is your name? She responded with Millie Larson. What is your date of birth? Your date of birth. My date of birth is 1/1/1936. And so there are our 2 identifiers. And then we'll go for the third. And we have Millie Larson with her date of birth 1/1/93. Millie, do you have any known allergies? No, I do not have any known allergies. So then we're going to prepare to provide her with her oral medication and her ventrogluteal injection. So I keep the gloves on. We will provide her her oral medication along with her water. Make sure that she takes it. So we provided her her medication, her oral medication. Then we're going to do this on Millie's right hip. Miss Millie, can you turn over safely for me, please? We're going to locate the greater trochanter. We're going to put the palm of our hand on the greater trochanter. Then we're going to look for the iliac spine, where we would put our index finger. And then the middle finger will go onto the iliac crest. I'm sorry, the index finger on the iliac spine and the iliac crest in the middle finger. And then at that point, where we have the V right here in the muscular part, is where we would actually be administering the medication. At that point, sorry about that, we would use our alcohol pad going from the inside to the outside, and then we will uncap our syringe here, 90 degrees, insert, pull back, make sure that there is no blood, and then we will administer the medication, withdraw, use our safety tip, make sure that we put our needle into our safety, or put our needle into our sharps container. Then at that point, we will open up our Band-Aid. Place the Band-Aid over our injection site, and then we're going to document that it was given for our Dolcostat, and then for our Haldol, our 2 milligram intramuscular, we're going to document that we have given it and the site that we give it in, which was the right hip.